Hey listeners, this is part 2 of Nourishing Your Essence with TCM Practitioner You. In this episode, we unpack the difference between acupuncture and acupressure and how we can increase our body awareness with TCM Principles. For now, stay tuned and enjoy the rest of this episode. So, we've been talking about gut health and I guess the symptoms and how it looks like. One of the other pillars that you mentioned is acupuncture. What is the difference between acupuncture and what you do, which is acupressure? And people usually just kind of think TCM and acupuncture is like synonymous. But how do we differentiate it and how do we make sense of that?
Acupuncture and acupressure is actually the same system. Acupuncture is practiced with needles that go under your skin. And acupressure is just pressure on your skin, on the surface. But yeah, it's softer. And the system means we have our 12 main meridians that go through our body, and they are connected with our inner organs.
Sorry, before you continue on with explaining that, what is a meridian? Because I myself am not so clear about that.
You can imagine it like cables in our body. Okay. Which are linked to each other, and on these cables or in these cables is energy flowing, like electricity, for instance. You can imagine it the same system in our body with qi. So electricity is the qi in our body in the meridian.
How do you use acupressure to help with gut health issues? Can you use it?
Yes. So on our meridians, on these cables, there are sensible points, just say acupuncture points, because a lot of people know acupuncture more than acupressure. And we use them to get our qi, our energy flowing. So let's say there's a stagnation somewhere, and then we can stimulate on these meridians, on these points, to tell them, okay, go to this dampness, go to the guts and tell them to dissolve. It's all about getting the qi moving, flowing. If there's a deficiency, we give them more qi. If there's a fullness, we try to harmonize it and we try to move it somewhere else. So we're always in balance.
So you have this dampness. I go to this TCM practitioner that can help me with acupuncture. And basically, as they put those needles, will this harmonizing effect be instantaneous?
If you are going to acupuncture appointments, you will have some of these, because if you just go once, the body is still maybe confused, because there's going to be activated something that you don't know before, that you don't knew before maybe. So you might have to go there 5 times or 10 times, but it will have an effect from the first time. Maybe you just don't know it, because you can imagine these points are also switches. And if you switch on something, there will be an energy flow that will move forward. And then with the 5th, 6th or 10th appointment, maybe it's already harmonized, but it's working from the first time you're going.
So you said 10 times. What would be the interval time you would say, like a week, every month? What do you recommend usually?
In China, actually, if they have something acute, they would go every other day. It's not that expensive there. They just go there. They're sitting in this room with, 10, 20 other people chatting with each other with their needles in their arms or somewhere.
How cool.
And it's normal there and not that expensive like here in Europe. And they go there more frequent. So it's also, done quicker. But here, since it's a little bit more expensive, every week would be wonderful until you got better, and maybe, visit them a couple of months later. But every week would be the beginning, the start here for your treatment.
So acupuncture, acupressure is used as like a tool for like preventive care, right? So if you don't feel like you have any symptoms or any issues, do you still go to them? Like, what does it do to your body, and how does it help by going to them if you feel fine? What's the benefit, I guess?
I haven't met a person yet where everything was fine.
We're human, right?
Yes, but that's okay. We don't always have to be in balance. So, trick question, since I've never met anyone without symptoms. There are people coming not aware that the symptoms are kind of important, and they come for, I'm here to try it out and for prevention. That's fine too. And the acupressure treatments that I give, they feel like massages. So they can come for relaxation. And when they're having stress, they also can come and just chill there. And I'm doing all this inner work for the symptoms that they didn't were aware of.
It's so funny because so I once went for a session, and it's exactly what you said, is that she basically covered my whole body. They put like a lot of needles on my face, but they also covered my whole body. And basically I had this amazing sleep for like 40 minutes. I was just sleeping, and all those needles are on me, but I had the quality of my sleep was the best. And I was like, oh, can I just stay here? And she's like removing. And I'm like, oh, all right, can I just like continue napping? But yeah, that relaxation was, I think, what I really needed.
Wow. I've been to an acupuncturist before for like an ankle issue, but I was so confused. I was like, I don't feel anything. And then after she was done, I was like, oh, there you go. There's no more pain. Because I could just see like hundreds of needles just like all over. And I just didn't get it. I'm like, okay, is this doing anything? Like, did I waste my time coming here? And then, this negative self-talk. And then I started walking, and for the first few steps, it was kind of weird. And then I forgot that I came there for an ankle issue because I was just walking and I didn't even realize that there was no longer any pain. I was like, oh shit, it actually worked.
Let's say if you come for prevention actually without any of these symptoms, it would be perfect, because in our body there will be always small imbalances, and these acupressure or acupuncture points will actually harmonize things. Like if you say you have pain, of course there will be taking attention to that pain on that ankle, but also they are trying parallel to harmonize where this pain comes from. Like it's acupuncture is not like popping pills. Like, okay, you have this pain, I will put some needles there. No, they will, like Guni said, take the whole body again and see, okay, this acne, where does it come from? Too much heat, maybe. Okay, I will put a needle down somewhere on the body, wherever, where you will never link the connection. And that's what I already said, where a good therapist would take it to the source.
How do you manage expectations when a client come, and so say there's a client like Tasha who said, like, I have like this pain, and they, usually if you're not very familiar with the practice and the fact that, it's a whole holistic thing, and they come and they want this specifically, and they're kind of blocked with that. How do you manage this, and how do you kind of inform them that?
If it's just about the body work, like acupressure, acupoints, I would just press that point. I would just stick the needle and don't tell them about it.
Okay.
Okay, let's say there is this ankle problem, but I also see she's stressed. So I would press the stress point, or the acupuncturist would just put a needle to the stress point. So they wouldn't have to explain it to you. You will feel better anyway afterwards. So.
And any homework kind of you would give them? Now, say they come to you, they feel better, but is there anything that they can do at home to continue reinforcing that healing?
Yes, I would give them some little home exercises. Like a lot of people, of course, say stress, or I don't sleep very well. So I tell them, okay, tap this meridian here, like on the outer legs. That's the gallbladder meridian. It contains very often a lot of stress. I will tell them, okay, tap there, stroke it, take your knuckles and stroke down. And all these little exercises I would tell them. Okay. Or the spot where your third eye is.
Okay.
Press that, massage that to calm down. Yes.
I used to have this uncle who would carry, like, those like the whiteboard markers, and he would carry it everywhere he went, whether he was going to a wedding or going to the office. Like, I swear, he had it in his pocket because I've seen him doing it at a wedding before, and I was like, what is this guy doing? And he would actually massage his leg with that pen, and like his arm. He'll be talking to you and he'll be doing it the whole time. And he used to just say it was circulation, but as you're talking now, I'm like, I think there's a link.
He's so cool.
Another one is like when I was living in Hong Kong, and in the morning, some elder would do Tai Chi, etc. But another thing that they would do is like they would tap themselves.
Yes.
Even in Malaysia, I remember.
Yeah.
And what is that? If you were to give us the TCM perspective, what are they doing actually?
They are tapping to get the chi flowing to wake them up. They are waking themselves up and stimulating it in that way.
I actually did a private with this lady who specializes in TCM and in Ayurveda. And so one of the breathing practices she asked me to do every morning is when you wake up, you start doing this tapping all over your body. And then you, like, as you're doing it, you breathe in and breathe out, and there's like a structure to it. And she said exactly that, like it's meant to open up the energy points in your body.
So how do you go about it? Because the thing is that what I see is that I don't know if, do you start from your legs first, from your arm first? How do you go about it?
Just because it's easier, I would start on the upper body.
Okay.
And then maybe they were following the meridians. If you take a look at Google meridians, or take some Qigong classes, they will show you where the meridians are. Like, let's say the whole arm, the inside of your arm, you can tap that down. And then when you're at your fingertips, you can tap it from there on the outer side up to your shoulder again. And that would be the first thing that I do, or they maybe did, and then go down the body, like the middle body, and then the legs, and then you've activated all your main meridians.
So basically, if I understand correctly, is like if you go one movement down, you would have to come so say you go downwards, you would have to go upwards to kind of balance out?
To circulate, to balance out, yes.
All right.
Right. Would you consider this acupressure? This is part of acupressure?
Yeah, part. But since you're tapping, maybe it's more going into Qigong. But yeah, you're moving the Qi. That's all it's about.
And so can people at home do any acupressure type of practices in the morning to help their gut health, to stimulate their digestive fire, in the morning when they start their day, before they start their day?
With the points, it's the points are, like I said, switches. You can switch them on and off. And in the morning, I wouldn't press immediately, because if you press an acupuncture point correctly, it can be very sensible. It can hurt. So I wouldn't do that first thing in the morning. Just tap it, stretch, maybe the meridian stretches. You can find that on the internet too. But for the digestion, you can always, if you feel tired or you have dampness because you're tired, have gas, obstipation, there are points that you can always stimulate every day. And for these who want to Google stuff, it's stomach 36, a very famous one. And what it's important for me, please don't expect, if you just press that point, that it will dissolve this dampness immediately, that it will heal you, because it's one point of your whole body system. We have over 300 points in our body, and a therapist would always use a combination of them. And since you are at home and you don't know all these 100,000 points, you can always do it to support you, but don't rely on them. And that's what I always tell my clients to do some little homework, support you. But yeah, I see it in the internet very often, like, okay, press that point, then your headache will disappear. Yes, for the moment. But if you want to have it long-term removed or healed, you might go to a professional, a therapist, which will help you with that.
Okay. And so in terms of gut health and we talked about some of the aspect of TCM around gut health, how acupressure and acupuncture could help. Anything that you would want, listeners to know that they could incorporate onto their day-to-day, or actually go and see a practitioner to help them with their gut health.
Movement is very important also for the digestion. You have to move every day for 15 minutes, we say in TCM, and it can be, soft movements. It doesn't have to be running, blah, blah, blah. Because if you eat food and it's just in your stomach, in your kettle, like we said, and there's no movement, it will just lie there and stick around. And so movement is important, and to know, or somebody who tells you what kind of right food, that's the source. If you are putting undigestible food every day inside of you, the best acupuncture won't help.
But what's a typical undigestible food?
Most common, we here in Europe, most of us eat a lot of bread. So it's white wheat, and then combined with sugar and fat. So the pastries, that's a very heavy load. And like I said, the cow milk products, because it's actually very nourishing, but we're nourishing us too much with that.
We're overly nourished these days. Okay.
What do you want listeners to take away about TCM? Like, when they think of TCM, and there's so much information out there. So if they're interested in it or curious about it, how would they go about it, and where would they start, and what should they keep in mind in that process?
When you start with TCM, you can, for a happy digestion, you can start with a warm breakfast, because when you wake up and have the day before you need some energy, and perfect would be a porridge or an omelette, because it's cooked, it's warm, and having 3 regular meals a day would be good. So the digestion knows, okay, I can rely on this human being that gives me food and energy sources. And if you have 3 proper meals with enough protein and fat, you will have less cravings or munchies in between. And another thing would be, if you already have a poor digestion or digestion problems, cut down, reduce raw food, because raw food is seen as cold and needs more energy to be proceeded. And if your digestion energy is already low, it's not a good idea to put something in that commands more energy. But if you have no problems with your digestion, and you live in a warm environment, just continue with raw food and smoothies and body awareness. You will learn with TCM how your body works individually, of course, and generally you will get the basics too, but you will understand how you can harmonize your body yourself. If you have one symptom after each other and you're treating them just as a symptom and not connecting it to your whole system, you will be always running to doctors. And if you know your system on yourself, like, okay, today I have cold feet. Why is that so? Okay, maybe the smoothie challenge that I was participating the last days is not for me. To connect these things, that would be important.
Great.
I really like that last point, because there's so much out there where they say, that challenge, like go keto or go this, do that, and we're all different, and it's about knowing what's right for you. And so as you learn how to listen to your body, you would be able to nourish your essence the right way. So that's a really good way to summarize our conversation.
And to be attentive to all these general suggestions, like, okay, take vitamin C or take this superfood. Yes, maybe it's a super nice food like maca or ashwagandha or whatever, but it will not have the same effect on everybody. learn that you're individual, that your body has its own history, and to treat it individually.
Yeah, great point that you bring up, because people tend to forget that it's just like, it's a superfood, so let me just like overly consume it, then I'm going to be really strong and fit or healthy. So yeah, thank you for reminding us of that. And I guess to wrap up, I'm sure listeners want to know how they can reach you, where they can find you. Do you do virtual consults, and how can they find you?
Yes, you can find me on Instagram with the name TCM.you. I spell it YU. And on Facebook, of course. My webpage is in German, but it's spelled TCM mityu.at. And you can write me an email in English, of course, as well. And I have online consultations, so you can reach me anytime.
Yes, thank you so much for like taking your time out to share your wealth of knowledge and experience with us, especially about farts. We didn't think about that much. So if you enjoyed this episode, go ahead and select that follow or subscribe button. For now, stay safe, and we'll see you next week.